Hey, good morning, everybody. This is Brittany Jennings, and I'm coming to you live this morning on Seniors Blue Book Live with Matt and Mary from the Alzheimer's Home Therapy. Good morning.
Good morning.
Good morning. Thank you for having us.
I'm so happy to have you both here, and we're going to kind of dive into why we're here, which is talking about your new Brain Fit program and segment that we're going to be doing here on Seniors Blue Book each month, and people can tune in and they're going to learn about basically the prevention, the reversing, and the slowing down of Alzheimer's. And it's such a huge topic, and it's such a useful topic for people, especially with everything going on in the world and being at home and being a caregiver. So we're going to get to that in just a moment. But I do want to, Matt, really quick, will you tell us just maybe a quick moment about Alzheimer's Home Therapy, just kind of touch on your, kind of general overview of your company?
Sure. Well, I guess it all started, I'm actually an exercise therapist. And by that, I not only help people physically, but I help people emotionally and cognitively as well. So I guess it all started back in about 2015 when I was hired by a New Hampshire hospital to put together an exercise therapy program for their patients with dementia. And ended up spending 3 years about working with, the different, everyone in the treatment team, the doctors, neurologists, physical therapists, occupational therapists, and just put together a program that was effective at, helping people manage their symptoms, just increase their, better their quality of life. With the goal too is my biggest goal at that time was to, get people that were further down the road, mid to end stage, that really couldn't participate, in groups, and be able to work with them, identify ways to get them to be able to, attend something without having difficulties. And the end result of the program was, something that really benefited people in all stages of dementia. So it really helps physically, emotionally, like I said, cognitively.
Awesome. Mary's a new face with you, of course. So I just want to take a moment too to welcome you, of course, to the Seniors Blue Book family, of course, because you're a part of Matt's family. So tell us real quick, just a moment about yourself, Mary, before we jump into, what is lifestyle medicine and just Brain Fit.
Terrific. Thank you. And I'm really excited to join Matt. His compassion for people with dementia was just what inspired me to join him. I've been working with Alzheimer's and people with dementia for, showing my age, 45 years. And, I started at 16 as a candy striper and owned my own home health care for many years over the last 12 years. And really why I joined Matt was because we can offer people hope. And that's very, very exciting. In the last 43 of those years, we didn't have that. We didn't have any hope. And today we have great hope that we can reverse dementia, prevent it, slow it down. And that's where the lifestyle medicine comes in, that we're so excited to be bringing to people in the area.
Awesome. I am super excited to hear all about it. And kind of each month, just for everybody that is watching, we're going to be having Brain Fit each month with Matt and Mary for people to be able to pick up those tips and be able to learn from these programs that you offer. And specifically, of course, you work with families, with caregivers, people one-on-one. And that's a service, obviously, that we definitely want to talk about and promote, because it's so important to understand the Alzheimer's disease. And Matt, you'll get into the behavioral side of things as well as the exercise program. And I think maybe we'll go ahead and jump into that now. Just talk a little bit about those, and then we'll kind of get into the program that you offer.
Mm-hmm. Sure. Well, the real goal of Alzheimer's Home Therapy is obviously to keep people, in their homes. And Mary talks about a lot is in optimal health. Because people that they live at home, they can actually live longer, happier lives. So again, it's our goal to keep those people at home. And part of my program is that focused more on people that were mid to end stage. And when I met Mary, her passion for for working with people to help prevent the illness and actually to reverse it. You know, I thought was great because, I mean, it's somewhat new to me. You know, her information was from Dr. Dale Bredesen, and you know, it's like I said, it's fairly new to me, and it's really, really exciting. You know, people that I've talked to about it, I mean, they're really excited just to know that, like she said, there is hope for people. And you know, that there are things that, you know, you can do. I have my the wrap of my car changed, and you know, ask us about Brain Fit. And you know, I've already had people come up to me, you know, yesterday at the grocery store, I had someone come up and ask me what that was, and you know, they just seemed really excited about it. You know, so it's like Mary said, it's all about hope, and we're excited to share it with people.
Awesome. And let's kind of jump into lifestyle medicine a little bit, and maybe whether it's Mary or Matt, kind of specifically, let's talk back through some of those details again for people that are listening that are wanting to know, what is lifestyle medicine? What are the components of that?
Me? Okay. Lifestyle medicine is using your life to make you healthier. Everything in your life, every choice you make makes a difference on whether your brain improves in function or declines in function. So the idea of using your daily habits, the choices you make to improve your health, to improve your cognitive function, this has been proven by neurologists all over the world. Neuroscience has shown us clear path that by changing your daily habits, you can change the outcome of your brain. You can grow brain cells till your last day on Earth. Your brain can reignite, it can rewire and start firing again. So the fact that we thought once brain cells were gone, they were gone, that was it, is completely false. That's old science. Today, we know that you can build new brain cells. And so much of this comes from what lifestyle choices you make, what you eat, whether or not you're moving, whether you're using your brain, whether you're learning new things. All of this is a part of general wellness, but of brain wellness. And the path for this is laid out, and now it's really getting the message out there to people that they're mostly in control. And by making new and different choices, they can change the direction of their brain and start improving their brain. It's really exciting. Within 6 weeks, people start seeing improvement in their brain function.
What are some of those components that specifically, would it be like diet, sleeping, reducing stress,
You got it.
hydration? I'm trying to think of the things that I know that I need to work on.
Absolutely, absolutely. You know, stress reduction was one people never really calculated, and it's huge to brain health. So we're going to be working a lot with very simple stress reduction techniques, and stress reduction is different for everyone. So I always say, in implementing all these changes, we don't want them to be stressful for you. So we're working on a very individualized, customized plan for people to improve their brain function. So stress reduction for you might be very different than stress reduction for Matt or for anyone in the audience. So that's really individualized. Diet is a little bit more straightforward. Sugar and carbohydrates are like fire for the brain. They're not doing a lot of help. So we're definitely looking at a ketogenic diet with a lot of green, maybe expressed like a green ketogenic diet, a very clean diet, a diet that removes processed food is a big part. Exercise, of course, has been proven over and over again, but it doesn't require a whole lot of exercise. Simple brisk walk can really increase brain function, and doing it every day is what's important. Sleep is another area that we need to all look at and make sure that we're getting optimal sleep and sleep that's helping recover our brain. When we're sleeping is when our brain recovers. So that deep restorative sleep is really necessary. The other thing is use it or lose it. You got to use your brain. You got to keep learning new things, trying new activities. And again, those should be fun things for you because we don't want to increase your stress. So when we're encouraging people to learn new activities, we're really looking at what they would enjoy learning, because almost everything you learn new, if it's challenging, it's going to help your brain function.
So you're saying that playing Jeopardy every night at 7:30 p.m. is a good thing for my brain?
It's a good thing. However, if you've been doing that for 10 years, it's not a new thing for your brain. So something better would be switching to Wheel of Fortune. But to do so, when you do something new for the brain, new neurons have to fire. So there is an emphasis on, if you do crosswords, and crosswords is what you do and you're really good at them, you're still getting some benefit, but it becomes routine to the brain. So we really want to challenge people to learn new things all the time. Maybe things that they've thought about that they would enjoy, maybe painting, maybe an instrument, maybe studying brain health. But taking on new challenges is really important.
Absolutely. Well, I will definitely consider Wheel of Fortune and maybe Family Feud. Just kidding, I watch all of them. I want to jump over to Matt. Can we kind of talk about specifically the exercise program of this?
Yep. So my exercise program, I actually incorporate sensory stimulation and brain games into one. A while back, I was actually, I love going to the gym, and I was on one of the elliptical machines and kind of leaning forward on it. It was on my phone, and I decided I've always really liked to do like word searches and and stuff like that. And I was on the elliptical for probably about 15 minutes, and I started doing the word search, and I noticed I was actually doing it a lot faster, completing things that I normally did. So I decided to kind of incorporate that in my program, working with people with dementia. And I mean, it's you really don't get as much of a benefit as people in early stages, or prevent people that are actually able to reverse it. But it's just amazing, even with people, you're working with somebody in end stage, and you go through these physical activities, sensory stimulation, and then the brain games, and combine them, and people afterwards, they're more clear. It's not something that that lasts, but their symptoms are more controlled. They're happier, they have better decision-making skills. So it's all about basically doing everything you can to optimize that brain health.
And when you're working with your clients one-on-one, specifically, of course, everybody's individual with what their interests are, or like you said, Mary, like maybe they've always wanted to paint, or maybe they've, whatever it might be for them. So let's talk a little bit about specifically when you bring this program into somebody's home, kind of like what's the process that you bring your clients through?
For me, two things. One, if I may, one thing I just wanted to mention is, along with doing private in-home coaching, we're also in a few weeks going to be starting the first Brain Fit group. And it's just limited to 4 people, and it's going to be 3 days a week. And we will be doing semi-private coaching here, but we will be focused on implementing all parts of lifestyle medicine. We're going to do the same thing with people on an at-home private basis, but it will include really what people's interests are and taking each category. So in exercise, are we going to be doing dance, or are we going to be going walking, or are we going bowling, or are we, so we're really looking at the individual. Maybe they have some home gym equipment, or would like some home gym equipment. So we're going to evaluate what they have, what they would like to do, and set up an exercise program specifically for them that they enjoy, that we can be altered at any time. And with each pillar of, I like to call them the pillars of wellness foundation, you know, so with sleep, people may not realize small, simple things they can do to greatly improve their sleep. So we'll look at all of those. What's the sleep environment? What's the room temperature? What is the bedding? What is the, you know, what kind of things are you doing before you go to bed? What's your routine? Are you preparing yourself for sleep? If you've got blue light coming in till right before you go to sleep, that's really going to interfere with the depth of your sleep. So all of those categories, the stress reduction, depending on where somebody's at, there are very simple meditations to learn. There's a simple 4-second meditation that the military uses that everybody can implement right away. And then other people are going to be very much interested in much more involved kind of meditations and yoga and such. So we're really going to individualize and customize it. With diet, we're definitely encouraging people to go clean and get off processed food and cut down the sugars. But the truth is, every step they make to improve their brain helps. And every step they make to hurt their brain hurts. So if you eliminate one bad habit and you add on one good habit, you just took 2 steps forward. And you can do this all at once and really dive in, or you can do it step by step. Once again, it's lifestyle medicine is individualized. It's about what works for your life, but it works in reversing cognitive decline. The big news really is that our brains aren't set. They are absolutely not set with one set, and we can reignite them, and we can have neurogenesis, the birth of new brain cells every day of our life. And we want to help each individual find the perfect lifestyle medicine for them to accomplish that.
And you made an excellent point. I was going to say, I know for me, like I'm one of those people, especially if I'm trying to lose weight, I'll just cut it all out. But I know sometimes like that doesn't work. It's got to be like you take one thing out and add one thing in and kind of make it a step process. So I know that is for more of a lifestyle medicine. That's more of a lifestyle versus just like something that lasts for a month or two. You know, that would be the difference, definitely.
Yeah, exactly. If you think about it too, it's all pretty interchangeable. You know, if you get exercise, you're going to be less stressed. You're going to be able to handle stress, you know, better. If you have physical activity, you're going to be able to sleep better at night. You know, so a lot of those things help each other. I would say probably the hardest part, you know, what Mary can really help people with is the diet. You know, even myself, I'm tempted at times, you know, walking through the store and you see the cinnamon buns laid out on the counter, and you know, I just gotta walk right by and not give them a second thought. But I think that's probably the hardest part. You know, I think people think when they hear us talk, they're like, oh my, you know, I gotta change my whole life. I mean, you do, but I really think that if you're really interested in, you know, saving your brain, you know, being able to function well, you know, it can be done. It really doesn't have to be that hard.
Absolutely.
It can be fun. It can be really fun too. I find alternatives, you know, I mean, I adopted this lifestyle myself. I just want to show you, if people haven't read Dr. Dale Bredesen's book, The End of Alzheimer's, I strongly recommend this. It's just packed full of all the scientific research that shows we're in control and we can make Alzheimer's very rare disease, and we can get our brain health back. And there's a lot of other research out there as well, but this works and it's worth doing, and we plan on making it fun for you. Finding alternatives in your diet is key. Like if you switch to a more ketogenic diet, there is no reason to be hungry. You won't be hungry. You actually the good fat, the coconut oils, the avocados, those keep you much fuller. But what I find for people is finding things they can enjoy, finding a new way to make cookies with almond flour and flaxseed and things, and still have hot cookies coming out of the oven, but they're good for you and they're actually helping drop your inflammation. So it's things like that. It's making this a fun journey because it is a lifestyle, and we don't want you to do it for a month. We want you to adopt it for the rest of your life so you keep growing your brain every day.
And I think too, I've been on keto diet before, and I can 100% vouch with you on, especially the desserts. I actually have a dessert ketogenic book, and I make cheesecake from it, and even down to it's like an almond flour crust at the bottom. And I won't get into it because I'm gonna have to go to the kitchen to eat one after this. But it's true. There's so many temptations out there, and if people realize, a lot of our doctors out there will say that they want us to go on this specific type of diet or eating style because they want to prevent heart disease, or they want to prevent these physical chronic diseases or help with those. But think about your brain. Sometimes I think we forget that this is something we can control. And saying, lifestyle medicine, it's not just your brain, but everything else too, that you might be dealing with health-wise. It's going to increase, it's going to make you healthier. So it's not just your brain, but, again, brain first, and then the rest of the body from there. It'll definitely help out with all those things.
Absolutely. Our brain uses 20% of all the energy we take in. And the brain loves the keto, the energies that fat gives us. It crosses very easily into the brain through the brain-blood barrier and gives us super energy. So that diet is really effective, but that diet's also really effective in preventing diabetes, preventing heart disease. So the benefits you get for your brain in this lifestyle medicine also benefit your entire body and benefit all your other organs and help prevent getting any of our chronic diseases.
Mm-hmm.
Awesome. Well, thank you so much. I do want to just touch on one thing, Matt. Let's flip over real quick to a community setting.
Yeah.
So, with your company, talk a little bit about we do have a lot of senior living, senior housing companies that watch our videos. Talk a little bit about what you can do to help in a community setting with their staff.
Well, I've contracted with a lot of different places, a lot of hospitals and assisted living, memory cares. I've taught home health agencies. And help them, develop a program that would really benefit, the residents. A lot of programs, places do have exercise programs. They do have activities that they can do, and they are great. But there's things that you can do, like I talked about before, like adding sensory therapy to it, including brain games in it. There's so many things you can do to optimize, the activities, and The other part of this too, so when I was developing my program, going through different things with people, I encountered a lot of problems. For instance, I had trouble communicating with some people. Some people were nonverbal. Some people were they had behavior problems. Some people just didn't want to get out of bed to do it. So I had to figure out, different ways to help manage these things so I could get people to the group, to be able to exercise. I mean, nobody wants to exercise really anyway, but going about it in a way that someone with dementia will understand really helps. And that's where I came up with my other program, Beyond the Basics, which is the caregiver training that helps people manage the more challenging aspects of dementia care. So anyway, to get back to the question, just working with them to develop a really optimal program to help people manage the symptoms, being able to get people that normally can't be in, a group setting because they're overstimulated, being able to get them in, just basically to improve their quality of life. I mean, that's my goal.
Well, and I think too, the goal for these communities is to obviously take the best care of these residents they can. If people are in a situation where they have to move into let's say a memory care community, nobody wants to make that decision, but sometimes they have to for safety or caregiver wise. And so you can come in and help keep those residents in place, especially those residents, like you said, that may have some different types of behaviors, or they're not adjusting or transitioning well, especially the first 30 to 90 days at least of a move into a community. A big change like that can kind of bring on, or it can help, you know, some of those symptoms or whatnot that were already there just enhance. So Matt can come in and help and meet with the staff and then provide his training program. And so I just wanted to touch on that a little bit, because I know there's a lot of communities that could really, really benefit from that program.
Yeah, and you know, I think that people kind of get stuck. For instance, when I first went to the hospital to start working with them, they had an exercise program, but they were doing the same thing for 15 years. You know, so they didn't think that they could really make it, you know, any better. But then bringing it in, just having somebody to give, you know, different ideas. I'll give an example. You know, a lot of people you see in senior living places, people hitting the balloon around to each other. I mean, and that's a fun activity, but if you add something like, so, you know, the first person hits it, they say the number 1, the next person 2, you know, that's just adding in some, you know, extra, you know, use of cognition. So it makes it a little bit harder, but it also makes it more beneficial for the person. You know, and something like that, I've actually done the group with some doctors when I presented the program to them, and we went through, and I mean, you can increase the difficulty of the activity. So you can say, instead of 1, you're going to use, you know, vegetables, and you got to say, you know, the first person starts with A, so you know, asparagus. The second person beets, and that just gets hitting it back and forth, and it actually takes a lot to be able to do that. And so it really does work. So there are definitely things you can do to change it up and to optimize the experience.
Awesome. Well, I'll make sure to put that in the post so that people can reach out again for everything that you guys have kind of touched on today. I want to thank you so much for spending time with us here this morning on Seniors Blue Book. And again, for everybody watching, we're going to be having these segments monthly so that you can tune in and you can learn from these experts. They're amazing. And I'll put your contact information, Matt and Mary, of course, in the post as well. People have specific questions to you to email or call you. And again, thank you for all of the knowledge this morning. And I always love seeing you guys. So I hope you have a wonderful day.
All right. Thanks, Brittany.
Thank you for having us. It's been great. Have a good day.
Thank you. And everybody, thanks for tuning in and have a wonderful day.